Introduction of Tibetan Medical Astro Institute. There's one reason, because I made this my presentation according to the students' view. So it's in Tibetan. So before starting my talks, I just thought that it's better to share the institution where Tibetan Medical and Astro Institute is and how these are functioning and what are the activities doing in this institution in relation to others institution like that. So many of these maybe among the Tibetan also, I think few of them been to Dharamsala. They saw Menzikhang building, but not inside what is in Menzikhang and what departments they do have and what their activities are there. So it is just roughly as an idea for all of you to maybe who've been before, Rinpoche knows very well, and many of these here in the doctor, they knows who are from Menzikhang, but many of you are not from Menzikhang too also, I don't know. I haven't seen your face, and I think it's good for you to have a look, So, the institution of this, where I'm working, like a Menzikhang, we generally, Menzi means, Men means medicine, C means astrology, or these days we call it astrology, not astroscience. And Khang means house, the house of medicine and astrology. And this institution was established in 1916 by 13th Dalai Lama in Tibet. So after the Chinese occupied in Tibet, many of Tibetans and His Holiness came to India. And then when the first time when His Holiness thought was that to preserve, to promote and the culture of Tibetans is very important for the identity of Tibet. And without preserving and promoting, it will be vanished, as we have a hard time in Chinese, and as you know that Chinese people, what they are doing during culture revolution and like that. Buddhism is already, there are many things has destructed during culture revolution, but still they are a little bit better, but we say that if things are going on, then we lose everything. So, and not only the preserving, but the work and the function of this Sovarikpa as a science of healing is not only for Tibetans, but this is for the humanities, for all people who are suffering, who need it. Because when I go sometimes in the West, Western people, sometimes they say, oh, I'm not Buddhist, can I come to see you, or I can get the medicine from you? But we always say, no, Buddha never said it is only for the Buddhism, it is only for Tibetan, or it is not only for India, but this is for whole being, and being in the sense of that even this Tibetan medicine could be given to the dogs when they have a very bad effects of the poison. We give, because this medicine has no poison at all. And these all are medicine are compound with a very reliable, like herbs and ingredient. We sometimes call 7 limbs of the Tibetan medicine. What the material which we use in the medicines are scientifically agreement, and during our Sorig recognition, which we had a meeting here in this, not the same hall, but in another hall, in the same place here in Saranath in 2008. At that time, we have a topic on each of these topics between the Ayurveda and Tibetan medicine. Comparatively, what are the difference between these two? So during that time, I just talked about the 7 limbs of the ingredient. And then at that time, the chairperson was Dr. Harsh Singh, who was here from Banaras Hindu University. He asked me to stop your talk. Then I was surprised why he's saying like that. Then he told me, did you make this yourself? I said, no, it is in the text. Oh, you people, your text is so advanced. In 7th century, you are talking this topic now, and this is WHO standard. Oh, he was quite surprised. That means the Sovarikpa is no more than a small thing. It's a very precious, So, as I said before, His Holiness' view is more for the future, more for the people, more for the public, more those who really need it, So that knowledge is with us. So we have to share and we have to promote and we have to preserve, So this is the institution where His Holiness re-established in India in 1961 in 23rd March. Now this year it goes into about 55 or 56 years, And this is the overview of the institution. And this is college. In this institution, we have full-fledged, college, medicines, pharmacies, and also for astrology department, and then administration and research center, quality control center, translation center, media medicines, all these are the departments of the institution. And this is the college where generally in the beginning, when we started in 1960, we have not that much students because qualified like that, the very difficulty. This institution was established in a very hard way with one doctor, yes, no or other doctors, only one doctor, which we call Dr. Ishidundan, is one of the legend doctor, and he was at that time, And then it gradually now we started, and this year we have 17th batch of students. That means almost 300 students we do have graduated from the institute, but among 300 is no more as a very high figure. Still, it is lacking. But now every year we do have a student for graduating in 17 to 18, 18 to 19, 19 to 20. Now we have built up the students for the space for their studies and boardings and everything. And then that is the main office, and this is pharmacy, and then that one is staff quarter on the entrance, and this is the backwards where we do have museum, and then the college enrolled, the study of Tibetan medicine is nearly 7 years these days now. Before it was 5 years in theoretical and 1 year for internship. Now the pre-college study is for 1 year more. So that means the modern technology you have to study and also relevant subjects to the medicine, because His Holiness always talks, we need both as an education plus with a good kind person. The good person comes from where? Education, you can go into the college and study, you can get the education, you will be graduated any subject what you study, but to become a good kind person is very difficult. What is the resources and where it comes from the kind person? It's a very based on spiritual way, So the relevant subject is also very important to study in Tibetan medicine, because there's ethical roles in Tibetan medicine about the motivation of the physician means what? Physician should sit only on the chair, or ask for good people to pay good money, or he should look for the destitute patients. So like that, anyhow, the now these days minimum qualification is 10 plus 2. Before it was 7th and 6th like that. In my time, when I was entering into medical student in 1972, at that time I just qualified up to class 6. Or 7th, That's why my English is not so good. And I could not improve. And all the subjects what we need to learn from the medicine point of view, astrology, and everything is in Tibetan language. And Tibetan language is these days is one of the very important language which you need to study more who are interested to study about the Buddhism and also medicine and Tibetan cultures like that, because everything is now in our language, but so far we say there's nearly about 2,100 Tibetan texts written in Tibetan language about the Sorig medicine. All these are in Tibetan. If you want to study more, if you want to learn some more, then you have to do this and you have to learn the language. Even in our institution, we do have a student from Buriyat who really studied Tibetan medicine, and also from Japan. And these all are also did study about Tibetan language and literature too. So then As I said before also, the language are mostly teachings and the professor, they do teach in our own language. And the candidate are on the science background and more on the science, And the age limit is very important, Normally in the West, there's no age limited. You can study with a 60 years old person also in the class. Sometimes you need to go. But here, the age limit is very important. For this crucial age, 18 to 25 is the one of the really appropriate age to study, because memorizing too much from the text to remember everything, when you study about the pulse, when you study about the unit examination, and also the text itself is very valuable in day-to-day works. That all the words are what you need to have or what you need to do in your practice. And then college takes new students every 3 or 5 years. Now these years, this time we don't have, every year when we have a graduation, we do have students for the second batch. And these are the few of the activities of the college, You can see about some of these girls and others who are looking on the balls. These are the tests. The examination is not very light and not small, They have to face 3 exams, final, half yearly, and first year, The weekly exam is also there. Then at that time, the exams are coming through the whatever the subject, because to become as a Tibetan Sorig physician, you have to study on the both way as a full-fledged, not only learning the subject, but you know how to diagnose, you know how to recognize the plant, you know how to make the medicine. In early time in Tibet, there's no special pharmacy where you get buy the medicine, but in the West, the pharmaceutical company is so developed, you don't need to keep any medicine in a home. You just prescribe and let them to go and buy the medicine. But in our systems, this one is one of the very important, as additional medicine is necessary, because we are treating the patient not one for all. One for all means it is something like a medicine which you used to give for every disease what you are suffering. Doesn't matter. But in Tibetan system, the disease are very distinguished according to it nature-wise, type-wise. There are many. So through that way, the medicine also compound in many different ways. And the right on the left side is just for recitation, about oral recitation, text what they have studied have to give the recitation, And then the right one is also similar. Then this is what we do have, sometimes we call about, for the prayer. We used to receive the initiation, empowerment, recitation, meditation. All these are practiced very important in Tibetan medicine. So this is one of the time when the students are doing this Yuto Nyingti, the prayer, and this is astrology. The astrology is very close to the medicine. Actually, the doctor should know a minimum astrology, because when you apply the treatment for externally, you have to know their individual date of channels and time and everything, When you pick up the herbs, you also need to do that. When you want to compose the herbs also, you need to look for that. So favorable day is very important to compound. And this is what the astrology department normally do for horoscope. And horoscope doing is also live horoscope, is also one of the prevention for disease. Because in horoscope, from your time of birth till the end of your life, forecasting in the horoscope, it's mentioned about your crucial years, from how many years, in 3-4 years, what is your time for health and mental. So if you done these also have mentioned about the solution, what you have to do for these to not to affect the weight or worse, So this is also one way. In the West, especially the necessary for the horoscope, you need to have a very perfect time exact. If you don't have the time exact, then the prediction is not very much correct. That is what we see. Because in the West, we have so many numbers waiting for the astrology for 2, 3 years also. Because of the astrology prediction for them in the previous was so absolutely correct. So there are a lot of demands are there. And this astrologer also do the same study about the for 5 years course, learning in our own language, and also doing not by computer, but they do by the manual. And then the few of these are the objects which we use in astrology, and this is the pharmacy in our institution where we used to make almost 150 different type of the medicine, and these all medicines are formulated in ancient time. And these are the type of this. You can see the shape. How is pyramid? It looks like a ball as a round. We can make in many different ways, but these are the mostly which we use in our medicine. When the medicine was prepared, there's no any life expiry date. The material, the things which you are using in the medicine, that has a life. You can use within a year, even especially for the herbs and flowers and like that. You cannot use after 1 year. There is no any powers in that using. So once it was compound, there's no any preservative also. If you keep well, it's okay. But you need to keep it out of reach of like humidity, dampness, like that. So these are the herbal products where we do have research department, and these research department do some production because sometimes the patients, they do have difficulty for taking medicine, but we used to make them in as a product form of teas, like teas and some application like that, So far 55 different type of the herbal product which we use. And then these are the machines which we use in the production. This is about the lotion, and these are very important department where the raw materials researching. And these are literacy research where the translation on about the Tibetan medicine books and texts and astrology. But one of the difficulties that the medical terms are very difficulty to use them into as a proper, because in the Western medical terms, as you know, that these are not very perfection to translate to Tibetan exactly, but we are trying. So far, the Gyushi, that 4 tantric texts, 3 of them we had already translated, and 1 of the texts is now going on. So it has also its commentary textbook to translate. Then translation department, this is clinical research, The clinical research is very important. We did research from 96 till now, nearly 10 different subjects for diabetes and also for blood pressure and also for drugs for the cancer and also for other things like hepatitis B, for the virus, for the liver. And also one of the very good achievement from this are the doctors who are doing statistician. They are really very surprised, because the effect of the Tibetan medicine goes down to the bottom, the cause, the root cause of the disease, what we are suffering, not as a superficially. For example, like HB, for like a sugar level, HB1AC is very much controlled by Tibetan medicine. Although your sugar level for fasting and PP maybe go up a little bit, but HB1AC, it was before 2030, it comes into 10, 12 like that. So that means the statistician in the AIMS, Dr. Pandey, who was dealing with us last 20 years, he said, this is a very good, material which you have, because your medicines are making and working as a good grassroots. There's no other medicine who can reduce the HB1AC, very difficulty. But in your medicine for 6 months, it works such things, So it was quite what you call like you feel like proud, and you need to be more in the future, do more research. And same as for blood pressure and same as for liver function. In the beginning, Tibetan medicine was so popular when I was in this student in 72 like that, because many hippies are coming at that time. 72 is the hippie time in India, because many of the foreign people who are really hard life, they come to India and have a good fun as a food wise and also life wise, and then they are suffering with the jaundice. And then this is hepatitis, jaundice, they are really fierce. So in Tibetan medicine, at that time, our doctor is Dr. Lobsang, she is laughing and she said, okay, 3 days you will get okay. Why you do worries? And from that way, the Tibetan medicine was promoting in the West so much that it is practically working for those diseases which are not curable in the West. Then laboratory, this is where quality control takes place. In these departments, our herbs, our production, everything are controlled with the 2 ways. One with the traditional way, another with the scientific ways. And then learning research center, because of this is a library where we have small library where the student and every doctor can see and look for the literature, what they want. But these are the map of India, you know that, and all these buildings are our branch. We have 56 nowadays, and there are many people who are approaching us to open more and more, you know. But due to the lack of the doctors, lack of, we don't have that much to open more, but we try to be open much more in the future. And same in the West. This is one of the store where we used to keep our medicine, and this is small dispatch sections online, you know, dispatch section, where we used to send by Korea. And some people who are not able to come, and those people who are benefiting by same medicine, they want to continue, but they could not come to Dharamsala to get the medicine. Then for those, we used to send by mail or by post. And then inpatients, very small inpatient, numbers of the patients are 12 beds, but these all are destitute, those who no one is looking after them. So we keep them in our small inpatient room and we treat it and we feeding them freely. And more of the chronic problems. And then these are the export products we do have, as I said before, the teas like that. And then this is account section, not interesting. This is internal audit section, not interesting. And then this is museum. We do have 2 very big museums. One is in Dharamsala, another one is in Ladakh. So in this museum, they have displayed so many instrumental things which in Tibetan medicine previous time, the surgery is instrumental, textbooks and astrologies and thangas and many related to that, and herbs too. And these are the few events of our institution. The first one was when we celebrate the 50th anniversary years of the institution. The left on my side is His Holiness Dalai Lama. Then that one Sakya when we have this college, 50 years, because college established in June, 2nd June in 1961. The institution was established 23rd of March. So there are few differences. And this blow is for Kamapa Rinpoche, as you know. And another one that on the right side is Himachal Governor, which we have some exhibition, you know, from the culture. And during that time, the governor came to visit the exhibition. And these are some activities related to the Emory University in the USA, where we have exchange of knowledge. They used to come to study some way about Tibetan medicine in Dharamsala, and we also used to give them as an advanced course like that, you know. So these are the few events of the talks given by the Emory doctors, and below are some activities and also our doctors giving them as courses. And then thank you.